Hello, this is Jerry Gordon, hands-on diagnostics. I think we have Jennifer here. Jennifer, can you hear me?
Yes.
Good evening. How are you?
Good. How are you?
Doing good. Doing good. You know, as good as you can in the middle of the week.
Yeah, amen to that. I don't know why they made these on
Yeah.
Wednesdays.
You know, we used to have them on Thursdays,
hmm
and I think some of the guys who were delivering it had trouble making those time schedules, so eventually they switched it to Wednesday.
Okay. Well, no problem for me.
And that. Yeah. I'm trying to remember which practice you're with.
One-to-one physical therapy and aquatics.
Oh yes. Okay,
hmm
cool. And we've met before. We had dinner together with everybody else.
Yeah. Yeah.
Daniel and stuff.
hmm
Good.
At the
I want to
symposium?
give it yes, it was. I think it was a
Yeah.
no, it wasn't a symposium. Although you probably were there. I just remember we were someplace that we with Dan and Demetrius and we went out to dinner at some place and um
Mm,
which well, I can't remember what that was, if that was a PPS or whatever. Anyway, um, anyway, so welcome. Um, usually give it just a couple of minutes to see if some people have showed up.
okay, no
Sometimes
problem.
people are a few minutes late and such. I've been talking with um, Dan about setting up meetings both with him and me also and with you.
Yeah, we have a
And
lot of questions on as far as marketing and billing and all the things that we need to make sure we're doing, especially now we're in the residency phase, how
yeah,
we need to do that. So,
oh good. I think I sent him an email with my calendar because we I've been trying to meet with him now for about a year or so, and it never seems to happen.
oh no, I might be your go-to person then for our clinic.
What was that?
I said I might
What
end
was
up
that?
being one of your go-tos for our clinic then.
Yeah. Well, it's also though going over with him the general strategic plan for growth. Seems like you have guys have a great, tremendous amount of potential there,
Oh yeah.
and
No, we do two testing dates a month where they usually send a couple ECS certified specialists and we
no, I
get
know
close to 45 to 50.
45 or 50 patients.
What was the question?
You said 45 to 50 patients.
EMGs, yeah,
Wow,
in a 2 day period.
that's that's hectic.
Yeah, oh no, it's crazy. But right now it's all we can do because we can only get them in twice a month. So now we've started the residency. We'll be performing them, weekly. Myself and Asia, my colleague, are both in the
Hmm.
residency program. So
Okay. Now, do you also handle marketing?
no, I do not. We have a marketing
Oh, okay.
director that I'll relay a bunch of information to and maybe get you hooked up with her too
Right. She
at
was the
some
one I
point.
think that I had met with. She was the one I had met with.
Sam.
Um, yes, Sam. Yes.
Yeah, I was gonna say I don't
So,
think it was me.
yeah. No. So you came in tonight, though. What kind of topics were you looking for since you're more in the clinical area?
Well, for me, I just wanted to start participating in the webinars just to learn as much as I possibly can about what we're going to be doing since we just started the
Hmm.
residency. We've been doing EMGs for over a year now because my
Right.
colleague and I have only taken module one. So we're kind of at the bare basics. But as far as all the things that we need to do, they've always just come in
Hmm.
and under like billing purposes and things like that. We haven't been doing any testing on our own. So that was kind of the thing, kind of preparing us long term for what we need to be doing to make sure we're getting busy whenever that point comes. So,
Yeah, sure. Hey, Christopher. Welcome.
Hey, thanks.
Yeah, I've got Jennifer on the line here too. I've
hello.
unmuted everybody. There's only three of us total here. Usually that's about what we end up having. So, Jennifer, just to clarify, we won't be going over any clinical stuff
Yeah, that's fine.
tonight. Okay, good. Just because I do get a lot of people who don't can get the email, and then they show up and they're just testing people. They want to learn about, the EMGs and all that kind of stuff.
Yeah, I need to learn as much as I possibly can. So
Yeah,
in all
good.
aspects, because I'll be kind of heading up a lot of this and relaying a lot of things to Dan and just about the clinic. The more I know, the better.
Of course. That. One thing for your area, since you guys, you mostly have is Medicare patients, right?
Correct.
Yeah. Now, there's got to be, I presume, some non-Medicare that come in that would warrant being
Yeah.
tested.
Oh no, there definitely are. I mean, we're aware of the insurances. The ones that we've been doing mostly are Aetna and Humana PPOs. We do have some self-pays, LOPs, and workman's comp that if we get approval for some of those, we're also doing. So we do have
Good.
some.
So those are you're doing good. Those you're doing yourself.
Correct. Yeah.
Okay. Good.
Well, not ourselves. I mean, we're doing them, but then we have to send them out for review and this and that. So.
Well, of course, you always have a mentor that he's going to be looking over your shoulder until you're board certified.
Yeah, breathing down our necks. No, I'm just kidding. I'm just kidding. It's Dr.
I understand.
Yeah.
I do understand. No. Well, he and Rick McKibben and that were in the military at one time.
Oh, really?
So,
that makes sense.
Yeah. Yeah. So, Christopher, welcome.
Yeah, thanks.
Yeah. What kind of things did you come here for? I want to make sure I'm going to be covering various things that are going to be of benefit to you guys.
Yeah. Well, it's really the whole gambit. I'm just looking to grab any information that I can. So I'm just,
Okay.
I wanted to make sure I attend. I mean, really, we're early on. I mean, as you know, we've got the gear and everything like that, and
Sure.
we're just sending off our first for billing. So I'm actually learning all of, I couldn't even speak an acronym about insurance or any of this right now, but I am doing authorizations for Kelly and walk through that process. So just trying to get everything with the split clinic in order and make sure that all the T's are crossed and I's are dotted. So everything from billing to all of the processes are important at this point.
Sure.
I'd rather we be ahead of the game in that regard and be set back a little bit on actually walking through the process of doing the diagnostics, so that when we're full blown, full schedule, that I'm not going back to trying to figure out processes, that we understand our processes and that we've got them dialed in. And since I don't come from the medical background, that piece is slowed my bandwidth down a little bit.
Good. Well, one thing I found is something that worth looking at that might be helpful for you. I'm going to show you my screen now. This is off the Hods.us website under Manuals Executive, and it's the flow of data for EMG testing. Okay, so that's where you would find it, and it's just a list of all the different data, the steps to go through, which I'm sure Jennifer maybe is familiar with, but Christopher is coming into the practice, his wife's practice, and learning all about it.
Oh, have fun.
So
yeah. Deep water.
So
we're a year in, and I still have a million questions. So.
Well, sure.
Yeah, and that's kind of what we're experiencing. So I just I'm doing everything from walking through the financial documentation for the equipment and insurance requirements and expansion of the clinic and new employees and writing contracts and you name it, HR, interviewing, so there's a lot, as well as just even trying to learn how to answer the phone in her clinic. So from the very most basic details to more complex, I'm kind of getting plugged into all of them. And then marketing and, attending chamber meetings, and it's just all of it.
Right. Yeah. So Christopher. This might be of benefit for you. It's sort of a sequence of what needs to be done towards the billing of what things to get, the diagnosis, the patient's name, physician's name, physician's location, phone number, referral from a doctor, et cetera, et cetera. So it's a reference that I found recently for people who are like just starting in and they're saying, oh, gee, so what's the flow for here? What do we have to figure it out and stuff? So this doesn't quite have everything, but
are you sharing the screen?
I thought I was.
Yeah, I see it.
Okay, hold on. Maybe there we go. Okay, I'm there.
Just kick it again. That's
Got it.
Yeah, so it's again, it's in the manuals, executive, and the third one down is flow of data for EMG testing.
Got it.
Okay, so something worth a reference that's worth looking at, I think. Okay, now in the billing course, Jennifer, and Christopher, the billing people will go through a billing course that we have. There are 2 spreadsheets that we want them to use, and there's designed to keep track of the diagnostic billing, so it doesn't go get lost in a EMR that's set up for physical therapy, and now they're tossing in some extra codes and how they get the reports and what's really happening here. It's just 2 simple spreadsheets that were designed by billing people and then tested out by several people, and so it's very succinct. The first one is just a billing sheet, which is listing all the diagnostic bills that are being sent out.
Yeah, we've been doing those.
Okay, and then the second one is, if one of these goes into denial, a billing sheet doesn't usually, and even the EMRs, I don't think, help track that. So we have a billing spreadsheet so that you would or add the bill that got denied over, now you've transferred over to the denial spreadsheet, and then it walks them through step by step on how to, what to do, what's the next step, how long does it take, what letter to use, and all this kind of stuff. Okay, but it's really great, well done, and that's what I try to get all the billing people to do, because then if anyone's ever wondering about, like, so what's happening here. In fact, hold on a second. Let me see if I can pull that thing up. Show you what it looks like. And let me see here. Billing notes. Billing grid. Pages. Appeals. It's a appeals spreadsheet. Let me just open that up for you here. So this is it. It's a complete instructions on how to use this appeal spreadsheet, and takes the billing person all the way through. But then, if you're ever wondering, like, what happened, why are we, what kind of things are we getting paid for, what's getting hung up and such, if you ask them for this, it's all right there.
Got it.
Okay.
And that was included in the billing course, yes? Correct.
It's a download. Good. And it's one of the things when I meet with the billing people after they've done the billing course, then one of the things I do ask them is, did they download that, and are they agreeable to using it? Because sometimes they might I got to do it my way type of thing. And it's like, they can do it their way, but then if they do it with this plus the other spreadsheet, anybody could see it in a quick snapshot where everything is at. Okay? And I see we've got Brian's come in. Hey, Brian, how you doing?
Doing good, Jerry. How are you?
Good. Welcome, welcome. We've got 4 of us now, and we're just going through a variety of different topics that people have showed up and expressed some interest in. I was just going into the billing spreadsheets that is part of the billing course. And what we ask the billing people to use is these spreadsheets, because you as the owner will know exactly what's happening by just glancing at these spreadsheets without needing a lot of explanation. The first spreadsheet, which is shown here, is just has a list of everything that's being sent out for billing. So you know what the date is and that. And it doesn't get lost in the EMR stuff for physical therapy. And then the second one is the appeals spreadsheet, which gives all the instructions to the billing person of, okay, it's been denied. What do you do? And then it just takes them step by step through and has them put in the date, the response, appeals letter 2, the response, et cetera, all the way through. So that you as an owner, instead of asking a broad question like, so how's everything going with billing, could just say, hey, can you send me those copy those two spreadsheets to me? And you could glance at them and know exactly what's happening with all your billing. Okay? So this is one of the tools that's part of the billing course, besides all the letters and things of that nature. Okay? So that's about it. The only variation we've been testing out now is we found out that we've been asking everybody, like when they're doing Medicare ultrasound, to use the physical therapy code 97750, which doesn't pay that great, but it does pay. But we found out, I think it was in November, October, that some of the guys out in Wyoming had been billing Medicare ultrasound with the standard ultrasound code that you would do with an insurance company, and they were getting paid for it. So I've asked a few companies. I'm sorry, we got some noise from someone. See if I can handle that. Okay. So I've asked some of the different offices to try that out and see if it will work. So far, the one or two that's given me feedback have found out that it was denied using the standard insurance thing, but we're asking them to use the standard denial process and letters and stuff like that and see if we could shake it loose. So it's something we're still working on because it pays a lot more than the 97750, which pays maybe about $100 or $80 or something like that. So that's one of the variations on billing. Christopher, you're gonna find you don't have a lot of experience doing the PT stuff, but the PT stuff, a lot of people are used to just getting paid regularly and not having too much problems with the insurance company. But with diagnostics, the insurance companies get a little bit thrown off by a physical therapist all of a sudden doing it, and therefore the denials come in, and so we have various ways of addressing it, which you learn about in the billing course.
Well, we just went through our first Medicare billing with a secondary insurance, which I think was Meritain or Aetna. But what we did to try to make sure that the process was correct was we used the HODS form to request referral from the doc, and then we, even though it's MSK and not EMG, and I know that typically it's not required. And we also got pre-authorization from the insurance company with the HODS pre-authorization form. And the only one that we didn't get to pre-auth was from Medicare. So we'll find out shortly when we submit with those codes. And I think, I mean, are you saying that we should just use the 97750 code, or go ahead and submit the other code?
Well, for the ultrasound, this is just for ultrasound, not for EMG.
That's what I'm talking about. We haven't done any EMGs yet.
And that if we're talking about straight Medicare.
Right. So
what I'm suggesting is you might try using the standard code 7881 or something like that. I can't remember exactly what it was. And actually, I'm going to tell you about it. Let me pull it up here. Bear with me a second. And I'll pull it up and tell you so I'm not being vague. And that Medicare, talking about using the 76881. Okay, that's the 76881 is the one that you would normally use for a regular insurance company, but you wouldn't use for straight Medicare. And we're suggesting that you maybe try that, and if it gets denied, just try it through. Because worst comes to worst, if the final thing they just deny it, then you just put it all back in with the 97750.
Got it.
You know, so one way or the other, you don't lose, but it's worth trying it out because hey, if it's working out in Wyoming, the reason why we never told them to use it before is it supposedly was not part of the PT, what they call taxonomy or the ledger, I guess, that has the codes on it. They just didn't have it in there. But if Wyoming's doing it, why shouldn't everybody else have that code in there? Maybe they just have to be found, but it might not work. So we're just trying that out.
Understood.
Brian, you had a question.
I do. So you're saying use the 97750 if the 76881 doesn't, like, if it doesn't take, how many units? Are you doing 4 units of that? Because that's usually a 15-minute charge, I believe, right?
It's 15 minutes. So you would do. I'm told that you would usually do about 3 to 5 units. It's supposed to be from the time you start setting up to the time you finished. You
Okay.
know, put the equipment away and such. So, you know, and it's usually about $28, I think, a unit. So it's not great, but I mean, see, originally we told everybody just do the PT code, which is the 97750, because Demi found, you know, was being told that hey, the regular code was not in the taxonomy for straight Medicare, and then we find all of a sudden Wyoming's getting paid $200, $300 for an ultrasound, and we say, what are you guys doing? And that's where we found that they had just put in the standard code and found out that they would pay, you know, and so so I've been asking people to do it and then go through the denial thing if it's denied, and
Right.
see if we could shake that loose. And then, of course, give me some feedback so I could give it to others who would be appreciated. So I think, Brian, I think I had mentioned it to your gal, but I never checked back with her to find out what the results were.
Okay.
That's your outside person.
Yes.
So anyway, so that's the whole skinny on the billing course. That. And Jennifer, I keep telling billing course and Chris Price billing course. The billing course is a series of 3 lectures, adds up to an hour and a half worth of listening, and it's very straightforward. Hell, when I first came out, I did it and got 100 on my test, so it can't be too bad. Because I've never done billing before, but I've now been learning a lot as I've been any questions that have come up. You know, I get into the thick of it, so I'm always the reference point on it.
Right. I'm told our biller just completed the course yesterday or the day before.
Oh, good. So if you could ask her to get in touch with me, or I'll send you my. I have a calendar link now because I'm getting so many meetings and that stuff that she could pick something like that, and we can have a quick call. And you know, I just want to go over the questions with her and make sure she's on board with anything and everything's good.
Perfect. I'll circle with you on that tomorrow on our FST.
Yeah. So on marketing, you know, you never can talk too much about marketing or review it and that because we're in the thick of things so much that we forget about it. The first line of defense on marketing is inside marketing in your offices, to your existing patients. If in your offices, it's good to put up posters. It's good to hand out flyers. You know, just making people aware of it, and they can talk to other people about it to go with the talk to other people that might have symptoms. And to get access to that, we have now under manuals. You guys can see my screen, I think. We go down to manuals, PR and marketing, and over here, we've got sections 1, 2, 3, and 4. 1 and 2 are the tools for in-house marketing. Okay. We have section 2 has got a brochure that's in a bifold format There's also a trifold format. There's a flip chart for ultrasound, and then there's posters. The posters are good to put up in your, in your various offices, just like everybody else puts in posters around their decor. And of course, the same posters when you're getting into doctors' offices, to get those put up in the doctors' offices, just to help promote what you guys are doing. And then you can use the same flyers and such for it. So all of these have been set up for download, and you can download them and modify them. But we've also set up with a company to be able to print these for you if you want. It's a company called printforless.com. They're in Montana, and anyone who calls in from Hodds will get a 20% discount. Okay, so if you open up one of these here, you'll see any moment the speed of my computer that now has me log in. Bear with me a second. There you go. You'll see all of this information about for example, this flyer. It's a bifold and trifold form. Down below is the information on Print for Less. When you call them up, you identify yourself, the Hodds group, you ask for the silver group. That's the group that handles, I guess, companies that have multiple locations coming in. And all of the instructions are right there. So there's an account number we've set up, although you'll set up your own, but at least it identifies who you are and what kind of discounts and what you want to do. Like you say, hey, I want to do posters. They'll tell you what the minimum quantity is and what information they need from you to create it, like your logo and all this kind of stuff. So they've been thoroughly trained up on this, and then they'll print it and ship it off to you. Okay. Now, you don't have to use them, but we just set that up as a service. Of course, we don't make any money on it. I don't even make any money on it. But what the heck? We got the other way you could do it would be you just download this and contact the local printer that does typesetting and have them do it for you and do the printing and such. So either which way you want to do it, but the tools are all there. Again, under manuals and that. And again, even if you're not ready for going outside, you still want to let all your PT patients know about it. So the in-house marketing is a way to go for that. And then there's also previous PT patients to market to, like, oh, hey, now we're doing this, and this is what we need to do, and we're going to do it. We're now doing diagnostics in that. Do you know anyone who's got tingling and numbness, or you go through all the different symptoms? Okay, so these are some of the tools that you can that we have on it. This is where you would find them. Now, in the outside marketing, there's two approaches, and this could be just for even getting referrals, not necessarily for going out into doctors' offices. There's a sample doctor cover letter as one of the approaches, and the other one is a sample survey that you could use, where it's just going to ask some very simple questions along the lines of, hey, do you do diagnostic testing along that line? And if they don't, then you can know how to approach them as to, hey, about, oh, look what we can do for you, diagnostics, the ultrasound. Ultrasound has been the best way I've heard of getting into doctors' offices, because a lot of them know about EMG or might even be doing EMG, but most of them don't know anything about everything else that you guys are going to be learning, including the ultrasound. And they get really excited about when they have someone come in. You could do a demo, bring the equipment along, and you do a demo on one of the doctors, for example, or one of their nurses or whatever, and they can actually see what the problem is. Which brings up a button that Nathan up in Alaska has used, and that was, come on in. We can see your pain. Come in, we'll show it to you. And obviously you could do a ultrasound and show them where the pain's coming from, and they can actually see what's happening in their body. And that was a great puller for him. Okay. So there's some of the different approaches. On the outside, one of the things that we are missing is a flyer for sending out for doing it in the doctor's office. That is, I'm sorry, for getting referrals or in some way of that, instead of doing a business opportunity. Because most of these for the doctors is for promoting a business opportunity. But if you're not there yet and you want to just get referrals, then I need to come up with a version of that which just says, hey, we're doing diagnostics, please send your patients, we'll get them in real fast, get your response back fast, whatever, we have to say. So I still need to get that designed and put on the website. Okay. Sometime later this year, we're going to be doing a redesign of the website where we'll have a dashboard and everyone will be able, when we meet, we'll go in and we'll have everything right there, like the roadmap will be there, and your schedule of courses, and everything will be there that we would need to know what's happening and where we're going, what's the next steps. Now, any things that I've not covered that maybe someone came here for looking for answers on? Brian, Jennifer?
No.
Okay.
Not so far.
Cool. Christopher, you got your hands up, but you've self-muted. So you need to unmute yourself. Oh, is that Christopher? Brian, anything that we haven't covered that you had your attention on?
No, I think these new trifolds and brochures look pretty good. I think it's definitely something I'd like to take advantage of. We mostly are doing in-house marketing. We brought in the Neurofascial Revealed course for our therapists, I guess about a year ago, and it really opened up the eyes. We have 16 therapists, and it's kind of opened up the eyes for who's appropriate to bill and test, because a lot of insurances for us aren't gonna, on the front end when we screen them, we see that their insurance has exclusions, and so we can do the testing all day long, but you need to kind of know who's appropriate for testing, who you're gonna get paid for testing on, and it's really helped us to kind of open our eyes to that process a whole lot better. So I think for us now, we've only utilized the in-house marketing, but are looking forward to doing some outsource, out-of-house marketing.
Oh, good. In fact, while I have you on here, if I could take advantage of it, we haven't been able to meet for quite a while. Is there a better time, or if you might give me an email with that, maybe let me know when when you are available for meetings?
I sure will, Jerry. Absolutely. I'll send you an email. I'll respond to the one you send me, and just trying to make sure that, because I'm using that time, but where we meet typically as overflow for kind of walk-in EMGs and nerve studies. So if I'm in the middle of testing, I do put you on the back burner. I know I shouldn't be doing that, but if I'm given the opportunity to test, I jump right into that. So I'll look at to make sure that there isn't a better time where we can be more consistent with our meeting.
Cool. I don't know if I had sent you a link to my calendar. I just set that up recently, just a few days ago, so that I could, because I'm getting, as you know, we've got about 44 partners now. So I'm going leaps and bounds in that, and my schedule's getting tossed around and used up quite a bit. So I'll send that to you, and that so you can pick and choose something. Even if we have to move it around, that's fine. Just that when I do have it, something scheduled, I make sure I'm there, set and ready to go and that stuff, and then we don't meet, and it's awful. No. Anyway, so we'll get that sorted out. But I'd love to talk to you about how we can get in, how I can give you suggestions, maybe some direction and stuff. Of course, my background has been marketing, sales, besides running businesses and such. So internet marketing and things of that nature. Not that I'm a super specialist on it, but I have seen what some of the things that are working and what's helping and stuff.
Okay, great.
So good enough then. The other things that I've mentioned a few things maybe before we end off on it would be some of the people that have had some successes is Nathan up in Alaska has a newsletter that I can send you guys if you're interested, that he sends out to, I think, broad public. I don't think he sends it out to particularly the doctors, but he might do it also. And every time he sends that newsletter out, he has patients responding. His stats go up. In fact, that's mostly what he does, although he did also a flyer that had to do with hands, and that was for doctors. It was like, send your people who have hand problems to us, and we'll take care of them. I can send you samples of that too. It didn't mention anything about either physical therapy or diagnostics. It just talked about being able to do hands as such, and specializing in it. And obviously, one of the things you have to do is either maybe an EMG if warranted, or at least an ultrasound to see what the problem is and such. So that worked out for him. Okay. The other thing we have, Jennifer, to let you know, what Christopher does, Brian knows about it, is we have a thing we call a roadmap, and it's a list of targets and steps that Dr. Kostopoulos, our founder, did, what he went through to create what he did as a very large practice doing diagnostics. And it goes through a fairly decent pile of targets and such to do. And what helps us is make sure that we don't miss any steps of, that would help the success. And it helps just give us guidance when we're meeting, so that we're very succinct to the point and don't have to meet longer than we want. I don't have to sit there and try to remember everything of what I've ever done with any particular partner and stuff. So it's a very helpful tool that we're using this year.
All right. And do we have access to that?
The owners of the companies do.
Okay. So I'll talk to Dan.
We'd have to talk to Dan.
Was that big book that they gave out at the symposium? Maybe?
Yes, it is. Yeah.
Okay. Yeah.
Big orange cover.
Yeah.
Yeah. That was the one in that. And we have an electronic version, and that's what I wanted to go through with him to see where he's at and make sure no steps were missed. Because those kind of things, if you miss some of the steps, then when you go to take off, all of a sudden you find out what you missed, and you don't take off as well.
Yeah.
So it's a really useful tool. So anyway, that's about it that I have that I could think of to cover. If no one else has any questions, I don't want to keep you guys any longer. And hopefully it was helpful. And
yeah, awesome. Even the information on the HODS US website, I didn't know that stuff was there. So.
Oh, do you have access to the website?
Yes.
Okay, cool. Yeah, it's up here we have lots of information in here. It's worth spending some time on it. It's everything from personnel. The personnel stuff has got a checklist on various types of jobs that would be part of the diagnostic practice. Okay, and they're well worth looking at. Like you have a clinical specialist, you have a clinical director. So what did that clinical director do? It'd be a good checklist to download and make sure that the person who's doing that post, even if it's yourself, got all the steps in there. Okay. So it's I'll just click on it here, and it's not that you can add to it and refine it, but it's something that it's gotten, the purpose of the position, the expected results, daily duties and responsibilities, the statistics to measure, how successful you are at, at what you're doing, possible bonuses, ideal profile for the job, all that kind of stuff. It's very comprehensive, and there's a number of these job position things located up here for
Awesome.
personnel.
Mm-hmm.
Yeah, so a lot of good tools on it. On the marketing side of it, this year we're looking to set up we have the Hodds group, we got the owners email group. We're going to have a marketing group so that through Google groups and that, so that all the marketing people can interchange successful actions and talk with each other to find out who's done what and what their successes are and such.
Awesome.
Okay, so that's one of the directions we're going in. So that's about it that I could think of to cover tonight. Sorry, there is one other thing. We have what we call OMS software. Stands for Objective Management Suite software. It's something I maybe should have even spent the night going on tonight, but it's on the web, and it's a software for entering in the essential statistics to, one, manage the practice, either from an executive or manager viewpoint, and two, for reporting to Hodds what's happening. And then when I meet with the various people, I can pull up graphs from these, as you will be able to from these, and we can see exactly what's happening and see what the trends are. The trends going up, are they going down? What is happening that can show problems, or hey, things are going great. What do we need to reinforce it?
Mm-hmm.
And it's got it takes very little to put all the information in. Monthly, it's maybe about, there's a monthly and a weekly module. It's about 5 minutes to fill in the data for the monthly. For the weekly, maybe another 10 minutes or something like that to put the data in. Maybe 10 each or something like that. But if you put that data in every month, every week, it starts creating a picture that can be used to manage the practice, the diagnostics. It even has profit in there. It has a lot of different things that it will graph for you, and the computer calculates by just putting in some simple building blocks. Okay.
Cool.
Yeah. And Brian, that's one of the things I wanted to. Are you familiar with it? Did we ever use that with you?
You've introduced it a couple times, yes.
Okay. So this is it's the same thing, but we've made a few changes to refine it and cut it down. Cut down how much data needs to be put in, and just make it more meaningful. Okay. So if we can, I like to work out a plan to get your people, even if they put in, let's say, the last 6 months worth of information, then going into 2019, we'd be able to compare it with a history of what you had been doing. And, when you and I take a look at it when we meet, it'd be very quick, like, oh, well, hey, everything's going up. Great. This is what we need to do. Things are going a little wobbly. This is what we need to do. Week later, 2 weeks later, did it produce change? Yes, no. Make changes, So it makes things very objective and quick to manage things. So, do you still have your login?
Do I? Yes.
Okay. You're welcome to go in there and check it. You'll see, if I have it, I will be putting it in like tomorrow. On that, there's going to be 2 companies in there. One is going to be the in-house, and one's going to be the outside business. The difference between the two is in-house is when you are doing your own billing. Even if you're renting space in a doctor's office, if you're doing the billing, that would be considered in-house. And outside business is when the doctor's doing the billing. Okay, so we'll have one company in there that is your in-house, and one that's going to be the outside. And then there's for the monthly, there's a combined that puts them all together, so that we'll be able to see as they're building, where the building is coming from and such, and what's it's going. So it's going to be very, very, very useful, I think. And, you'll know exactly what, from a business perspective, what's happening with the business.
Sounds good.
Yeah. So we'll get into that next. And Christopher, I've already talked to you about that. And Jennifer, now you know it exists.
Awesome. Thank you.
Yeah. So it's something that, you could set up so that you'll know what's happening. Like, for example, keeping track of all the people doing testing. We could, have that data in there, and you'll be able to then see the graphs. And if someone is not doing good, you could send them their graph by email and say, hey, look, this is what's happening. Can you give me an idea of what's the problem, as an example? So it's a very good, it keeps things objective. It's not like you come up to someone and say, hey, why is it slowing down, and they say, well, no, it's not slowing down. But instead, it's like, okay, look at your graph. See, it's going down. So what's happening? And that way it's between them and their information, and their data and the graph, not them and you.
Right.
So good enough. Okay, guys, I'm going to end off here. Thank you all for coming. And sounds like we made some headway on some areas. And I appreciate you taking your evening off to meet with me.
Yeah, thanks, Jerry.
Yeah, thank you very much.
Really great.
Appreciate the marketing piece. I'm looking at it now.
Excellent. Good, guys. Have a good evening, and we'll stay in touch.
All right. Talk to you tomorrow.
Thank you.
Thanks. Bye.